My last video on myasthenia gravis went viral where I featured my patient who said that she had gone to about 2 hospitals where she was given glasses and was not correctly diagnosed. And that sparked a lot of debates in my comment section about who should we now be seeing as our eye care provider if eye clinics are not able to correctly diagnose our eye problems. Let's talk about that today, only on Eye Matter with Dr. S. First of all, I want to say thank you to all my followers. I have over 1,500 new followers thanks to that video. Welcome to Eye Matter with Dr. S. Here, you would learn only correct knowledge about your eyes. So without further ado, let's get into this question. Who are we supposed to be seeing as our eye care provider? Let's break it down. So currently, there are 3 terms and 3 professions that people are always misinterpreting. We have opticians, we have optometrists, and we have ophthalmologists. So let's talk about who are these people. I'll start with the optometrist. Now, optometrists are primary eye care givers. What that means is that if you go to private hospitals, your nearby eye clinics, you are most likely to see optometrists. These are people that went to optometry school for about 6 years, I believe, and are being trained to be able to recognize eye diseases. The role of the optometrist is very important because we have a very large population size and few medical doctors overall. When you go to an eye clinic, an optometrist should be able to examine your eye and say there's something abnormal about this eye, and they should be able to carry out basic tests and ideally be able to interpret this test. But even if they can't interpret the test, they should be able to send the patient with the test to see an ophthalmologist. They can treat basic diseases as first line, such as dry eye disease, such as allergies, such as refractory problems, like if you're short-sighted, long-sighted, etc. They can prescribe glasses and follow up on how you feel after wearing glasses. Now, this is a synopsis or summary of what an optometrist can do. But an optometrist is only a good optometrist when they're able to recognize that this eye problem, there's something about it that I'm not sure. Please let me refer you to an ophthalmologist. That is what makes a good optometrist. An optometrist that sees something that he or she thinks is a problem, starts to treat, patient returns, I'm not feeling better, keeps treating on their own and managing on their own without fully understanding what the problem is. Now that is a terrible optometrist. Optometrists should be able to draw a line between I think I can manage this and I don't think I can manage this. Please go to an ophthalmologist. The moment they cannot draw that line and decide to manage themselves an eye condition that they are not sure of until the patient's vision gets worse, that is a terrible situation. That is a terrible optometrist. And unfortunately, we have a lot of optometrists that are just like that. Which brings me to the opticians. Opticians do not see patients at all. Opticians are people that when the optometrists do the glasses test, they give them to put the glasses together. So opticians are able to read prescriptions that ophthalmologists or optometrists give them, and they're able to fix the lens into the frames. These people do not have one-on-one patient consultations. They only deal with prescription that the ophthalmologist or optometrist gives them. So no, you cannot be seeing an optician for your eyes. You should be educated about that. Now, ophthalmologists are medical doctors. These are people that went to medical school for 7 years, graduated, did their house job, and then went into residency where they specialized specifically in eye surgeries and diagnosing eye problems for another about 6 to 7 years. And when they finally graduate from their residency, they have an additional 2 years to subspecialize in an area of interest. There are about 7 areas of interest for ophthalmologists. The first one is vitreoretinal specialists, specialize in diseases of the retina. So people with diabetic eye diseases, age-related macular degeneration, retinal tears. And we have the anterior segment and refractive surgery specialist. These are people that really specialize in cataract surgeries. They specialize in refractive surgeries. They also specialize in corneal opacities. Then you have the glaucoma surgeons. These are people that perform surgery for glaucoma patients. There are different types of glaucoma surgeries. These people are the ones that specialize in diagnosing very early glaucomas. And then you also have oculoplastic surgeons. These are people that deal with external eye abnormalities like your eyelids. Eyelids are drooping, or they are too opened, or they are disfigured. Also deal with cancer of the eyes. Then you have the neuro-ophthalmologists. These are people that deal with nerve dysfunctions of the eye, like myasthenia gravis that I spoke about, eye problems from nerve damage, like tumors that are inside your brain. Then you have the pediatric ophthalmologist. These are people that specialize only in children eye disorders. They are the ones that do squint, quarter past eye surgery, any form of abnormalities in your children's eye. Now, when it comes to children, even prescription of glasses for children is a highly specific and specialized area. The optometrist in this case must work with the pediatric ophthalmologist to get the best treatment for your child. If an optometrist is the only one that is managing your child, you have it wrong. Nobody's an island of knowledge, myself inclusive. I don't know everything, but I know exactly when to refer and who to refer to, and that's exactly what makes you a good doctor. As a patient, when you walk into an eye clinic, you have the right to ask, "Sir or ma, are you an optometrist or ophthalmologist?" And the optometrist or ophthalmologist has no right to feel any type of way with that question, because you should wear your specialty with pride. It's important that patients recognize that at least they have the power to always seek another opinion in another hospital and should know the person they are dealing with. I hope this video has been helpful, and I'll be seeing you in my next episode. Thank you for watching.